Interventions with a King. Discussion and commentary based on articles from JACC, Cardiovascular Interventions.
Hi, I'm Walter Mashman, Deputy Editor of JACC, Cardiovascular Interventions. I'm here today with Dr. Chu Wang from Cornell University to discuss a recent study that he's done regarding hemostasis and a new closure device. Dr. Wang, thank you for being here today and speaking with us.
No, thank you, Dr. Mashman, for having me here.
Could you please give us some background about the frequency of these procedures? We're talking about 6 French interventions and diagnostic catheterizations. Tell us something about the numbers.
In the United States, currently we do about 3.5 million procedures a year, including diagnostic and intervention combined. And the rest of the world combined in total, worldwide, is roughly about 11 million procedures a year. And of those procedures, currently roughly about 30% or so of the cases at the end of the procedure, we do close them with one way or the other, one form or the other, the vascular closure devices. It's being deployed in them. And the majority is still, I think, still being closed with manual compression.
There are a variety of vascular closure devices, and you've studied a new device. Tell us what the need for a new device is and what's unique about this.
Sure. I mean, you can, in brief, sort of divide the current device, closure device-wise, into two broad categories, if you will. One is sort of a passive one, and we've been using it for years, and including some newer patches, for example, and some clamps device which we've been using for the last couple of decades. Don't forget about manual compression, and don't forget the gold standard still in terms of treatment of access site closure. And in the last decade and a half, since the early to mid-90s, there's introduction of active closure devices. These could be suture-based. In the market, for example, now examples which are ProGlide, PerClose by Avivascular, or suture and collagen-based. And one of the most popular device and most frequently used device, I should say, is the AngioSeal device, which is a combination of suture as well as collagen. There is also a need for these devices, just because if you look at the numbers of procedures we do currently in this country, as I indicated before, only about 30% of procedures being closed. That means, in general, there are the operators are either not satisfied with what's currently available in the market in terms of vessel closure devices. And I think there's some unique features of these novel exosuit devices that we studied and studied back in the late 2007, and it's going to fill some of the void in terms of patient comfort, in terms of potentially the amount of inflammation that's potentially can be caused by the currently existing devices.
Tell me very briefly, please, the design and the major conclusions from your study.
Okay. It is a 17-center, multi-center, mainly U.S.-based study. We enrolled 400 patients, to be exact, 401 patients, in a 2-to-1 randomization scheme favoring the vessel closure devices, meaning 2 patients in that trial will be assigned randomly to receive the ExoSeal, which is the training for the product of the vessel closure device, and 1/3 of the patient will receive manual compression. And we're looking at 2 major endpoints. One is the efficacy endpoint, which is one of the primary endpoints, which has 2 components, and it includes the time to hemostasis and time to ambulation. And the second primary endpoint is obviously the safety endpoint of the product, which we look at the major adverse events that's associated with the closure device as compared to manual compression.
Tell me very briefly the major conclusions.
The major conclusion is in the efficacies endpoint, we've shown that the average time for us to stop the groin from bleeding is roughly about 4.4 on average minutes in the device group, compared to 20 minutes roughly on the average in the manual compression group. And the time that patient can start walking, ambulating 20 feet or more without any complications, if one receives the device itself, it's roughly about 2.5 hours after the procedure, versus the manual compression group, which is about 6.2 hours following the procedure. Now, it includes both diagnostic as well as interventional patients, and part of the design of the trial is to have 50% of the patient undergone diagnostic 6 French, and half of the patient enrolled is 6 French interventional procedures.
Dr. Wang, I very much appreciate you being here with us this afternoon. For Jack Cardiovascular Interventions, I'm Walter Mashman. Thank you for tuning in.